Hello, good morning. In this video, we'll learn about alteration in personality due to illness. I'm Rima Stanley, lecturer at Triple M College of Nursing. So the objectives of this video is, at the end, we will learn about what is illness and what are common behavioral changes due to illness, and also some of the nursing intervention in order to help the patient during the process of illness. So, what is illness? Well, illness is a very subjective and highly personal state within which you would see the physical, emotional, intellectual, social, developmental, and spiritual functioning of the person is disturbed or decreased when compared with the previous experiences. Now, how the people behave when they are ill is very highly again individualized, and there are a lot of factors that influences in a manner that the person behaves, such as the person's age, gender of the person, occupation, socio-economic status, religion, ethnic origin, psychological stability and personality, and the mode of coping of the person. So behavioral changes, which is associated with short-term illness, are very mild and short-lived, while individual may become irritable, resulting in a lack of energy or desire to interact with family members or friends. And more acute responses are likely with very severe, life-threatening, chronic, or disabling illness. So here are some of the behavioral changes due to illness. That is withdrawn behavior, changes in self-concept, body images and lifestyle, self-centeredness, demanding and depending behavior, uncooperativeness, hostility, shame, and guilt. So now let us see each one. First one is withdrawn behavior. So illness, especially long-term or severe illness, may cause the patient to withdraw. And this is regardless of whether the patient are in hospital or at home. They may avoid interacting with other people. They remain in their rooms or resort to solitary activities. They may they may lose interest in all the things that they usually enjoyed previously and become depressed and try to close themselves off from their surroundings. All this increases their loneliness and feelings of rejection. So, illness also weakens the feeling of security. And here, there are various factors again that also brings about insecurity, such as a delayed diagnosis of the person, uncertainty of recovery, the changes of place or strangeness of place, and also the people surrounding the patient. The changes of daily routine can also bring about feelings of insecurity. Next is the changes in self-concept, body image, and lifestyle. Certain illness can definitely bring about changes in body images or the physical appearance, especially such as severe scarring or losing a certain part of the body or sense organs such as vision, hearing. So this patient's self-esteem and self-concept may also be affected because of these changes. Now, coming to the self-concept again, which is very important aspect in relationship with others or family members, and a patient whose self-concept changes because of illness may no longer meet the family expectations, leading to tension or conflict. As a result, the family members may change their level of interaction with the patients too. Illness also imposes a certain amount of restrictions, which brings about changes in their lifestyle. And this is regardless of the person's age, socioeconomic status, or profession. Normal activities have to cease for some time, and normal interests and responsibilities have to be given up because of the illness. Self-centeredness. The individual, again, experiencing illness gets too personal. The threat posed by the illness typically causes the patient to become too much preoccupied with themselves and their health. The individual is to notes the changes in him and show much concern about his illness. As the seriousness of illness increases, even less attention is paid to the outside world or concern for others is decreased. They find themselves to be more important and tries to be more careful about their own health every time. So self-centeredness interferes also with the quick recovery of illness. Therefore, it has to be also taken into consideration while taking care of the patient. Demanding and dependent behavior. Many patients tend to regress to a more childish level of behavior as a reaction to illness. This shows a behavior of adult patients who are highly demanding or anxious or excessively dependent on others. Adult patient who seems to be afraid by taking the treatment and reactively are also regressed. Next is uncooperativeness. So individual reacts to illness in many different ways. Some patients are uncooperative and show reluctance towards healthcare, such as by failing to come for a treatment, follow up, refusing to take medications, etc. Or they do not alter their lifestyle or activities, etc. So this sort of patients are often labeled as uncompliance or uncooperative patients in our healthcare settings. And therefore, because of uncooperativeness, the mutual effort towards recovery becomes very difficult between the nurse and the patient. Next is hostility. So this is again a type of aggression that can cause a purposeful harm to themselves and to others. This is mainly because of anger and provocation. The patient may be angry about the helplessness of the situation, unfair state that he's been diagnosed of a particular illness which is unacceptable. And hostility may, in many circumstances, be inwardly directed by person having feeling of worthlessness, and it manifests itself in self deprecating and self punishing behavior. Next is shame and guilt feelings. When patients believe that illness is a punishment of sin or wrongdoing, yes, they experience shame and guilt feeling. And also certain illness, such as which is considered a stigma or which is socially unacceptable, for example, such as communicable disease, AIDS, leprosy, etc., which can cause a patient to be rejected. So that sort of illness definitely brings about a shame and guilt to the patient. And of course, there are various other reasons also why the person feels, especially this depend upon the type of family the patient belong to and the cultural background. Now let us see the nursing intervention to help the patient reduce or overcome all those feelings. So the first thing is, as a nurse, needs to help the patient express their thoughts and feelings, and to provide care that helps the patient effectively cope with changes. Next, feeling of insecurity can be also lesser by explaining the patient about the hospital conditions, procedures, including detail of routines, by being warm and reassuring in in her manner and thoughts, and through the personal interaction with the patient. Withdrawn patient needs gentle encouragement to talk, to express feelings, relate to the nurse. So the nurse should spend adequate time with these patients, even in silence, as it increases their sense of worth. Next is to explore the reason for anxiety and communicate it clearly. Also convey an enthusiastic readiness to take care of such patients. Failure to do often aggravates again dependent or demanding behavior. So patients' negative feelings must be replaced by feeling of hope, courage, willingness to cooperate. Nurses also have to build up a healthy personal relationship that are the relationship of confidence and cooperation with the patient. The patient should not be allowed to regress, but should be encouraged to participate in recreation activities individually or in group, depending on the situation. The nurses should also find out the reason for anger and stop it right in the track. The nurses can also help the patient verbalize his feeling and perception about this problem. With verbalization, anxiety subsides and behavioral problems can also be reduced. So, keynotes. So, during illness, it is not uncommon for individuals to experience changes in their personality. These changes can be attributed to various factors, including the physiological effects of the illness itself, the psychological impact of being unwell, and the side effect of medication or treatment. So, the common ways in which personality changes can occur during illness is mood changes, fatigue and apathy, cognitive changes, emotional instability, changes in social behavior, coping mechanism. So it is important to note that not all individuals will experience personality changes during illness, and the extent and the nature of these changes can vary greatly depending on the individual. The specific illness and the other factors are also there that influences. So if you or someone you know is experiencing significant personality changes during illness, it is advisable to consult with a healthcare professional for a proper evaluation and guidance. So reference Rivani Psychology for nurses and also from personality assignment test. Thank you for watching this video.